Okay, so you asked for it, a deep dive into autoimmune and immune deficiency disorders. And wow, you've given us a lot to work with.
Yeah, lots of great sources.
Yeah. So the goal today is to, I guess, to really get to the heart of what's going on with these conditions and try to pull out like the most important and just most fascinating aspects of them.
Yeah, so basically we're looking at the immune system, but like from both sides. On the one hand, the body is attacking its own healthy tissues,
Right.
and then on the other hand, it's weakened, so it can't fight off threats.
Right. Right.
It's a whole
Yeah.
spectrum, but we're going to I guess, focus on what's really key to understanding these conditions.
Okay, so we're going to start by looking at rheumatoid arthritis, SLE, and myasthenia gravis. These are all examples of the immune system kind of like attacking itself, right?
Yep. Yeah.
Then we'll shift gears to HIV/AIDS, and we'll see how a compromised immune system can lead to a whole host of complications, like opportunistic infections and certain cancers and blood disorders. So I guess let's start with rheumatoid arthritis.
Okay, so rheumatoid arthritis, or RA. It's a chronic condition where basically your immune system is attacking the lining of your joints,
Mm.
the synovium.
Yeah.
And it's not just your joints, though. It's systemic.
Hmm.
It can affect your whole body. And we don't really know what triggers it.
And I've heard that RA can be kind of unpredictable for people living with it, right? Like you can have good days and bad days and periods of like remission and then like these flare-ups. So when doctors are trying to diagnose someone, what do they look for?
Well, there's a few things. First, they look for elevated CRP and what's called the SED rate.
Okay.
These are just general signs of inflammation in the body. Then they look for positive ANA. That just tells us there's some autoimmune activity happening.
Mm-hmm.
And then they look for a specific antibody called rheumatoid factor, or RF. About 75% of people with RA have it. Then there's anemia. They might see signs of anemia in a blood count.
Okay.
And I guess over time, they'll use x-rays to see how much the joints are being damaged.
So it's really a combination of things,
Exactly. Yep.
not just one single test. What about how RA actually feels? Because I think a lot of people think it's just joint pain, but it's more than that, right?
Right. It is. Of course, there's the joint pain and especially the stiffness people feel in the morning. But because it's systemic, there's a lot more. Like fatigue, weight loss, low-grade fever, just feeling generally unwell, loss of appetite, even muscle weakness.
Yeah. And we've all seen images of the, really severe cases and the way it changes the shape of people's hands.
Right.
Can you describe what those deformities look like?
Yeah. So one's called boutonniere deformity, so your finger joint bends inwards,
Yeah.
but the fingertip bends back.
Mm.
There's also something called ulnar drift, where the fingers start to angle sideways towards the pinky.
Okay.
And then there's swan neck deformity, where the joint closest to your knuckle bends back and the end joint bends down. So it really affects how people use their hands day to day.
It sounds so limiting. How do doctors manage it?
Well, there are medications to reduce inflammation and hopefully slow the progression. In some cases, they'll do surgery, like joint replacement.
Mm.
And then there are a lot of physical therapies applying heat, cold, doing exercises to keep the joint strong, flexible. You can also use assistive devices like canes or splints. And it's super important to manage stress because stress can trigger flare-ups.
Oh, that's a good point. You also mentioned medications. Can you talk about those more?
Sure. So there's salicylates like aspirin and NSAIDs like ibuprofen or naproxen. They help with pain and inflammation. You have to be careful with them, though, because they can increase your risk of bleeding if you use them long term.
Okay.
And there are corticosteroids, prednisone, for example. They reduce inflammation really quickly, but they can increase your risk of infections. Antimalarials, like hydroxychloroquine, are also used for RA, but they can affect your vision, so you need regular eye exams. And then there are gold salts. They're older type of treatment, and they can also cause bleeding.
So lots to keep in mind.
Yeah.
And how about diet? What role does that play in managing RA?
It's actually super important to eat a nutritious, well-balanced diet.
Mm-hmm.
People with RA can be malnourished and more susceptible to infections, and infections can actually trigger RA flare-ups. Also, if their red blood cell count is low, they'll need to eat iron-rich foods.
Okay, that makes sense. Now let's switch gears to SLE.
Okay.
It seems like it can affect way more of the body than RA, right?
Yeah, RA is mainly focused on the joints, but SLE, or systemic lupus erythematosus, is a chronic progressive autoimmune disease, and we don't have a cure for it yet. It can affect any organ in the body, like your skin, joints, kidneys, brain, literally any organ. What's happening is that your immune system, specifically the B lymphocytes, they start producing these harmful antibodies that attack your own tissues, and this leads to inflammation.
So how is it even diagnosed if it can show up in so many different ways?
It is a challenge. It takes time, and there's no single test. What they do is they use a set of criteria, both clinical and immunological. A patient usually needs to meet at least 4 of these criteria to be diagnosed.
Can you give me some examples of those criteria?
Sure. One is the butterfly rash across the nose and cheeks. Then there's photosensitivity, that's just being sensitive to sunlight. And there's oral ulcers, which are sores in the mouth. Arthritis, just like with RA, is another one. And there's something called serositis. It's an inflammation of the lining around your lungs or your heart.
Hmm.
And kidney problems can also be a sign, like if there's too much protein in your urine. And then there are neurological issues, like seizures or psychosis. Hemolytic anemia is another one. That's where your red blood cells are destroyed.
Okay.
And they'll also look at your white blood cell count and your platelet count. And then there's some specific immunological markers they can look for in the blood, like LE cells and anti-DNA antibodies. And sometimes they'll even look at a syphilis test. If it comes back positive, that can be a sign of lupus, even if you don't have syphilis.
Wow, that's a lot. I can see how it could be hard to diagnose, and I imagine the symptoms themselves are pretty varied too.
Yeah. Aside from the criteria I just talked about, there's joint swelling, pain, fever, swollen glands, nausea, vomiting, loss of appetite, high blood pressure, infections of the respiratory system and the heart, enlarged liver, enlarged spleen, tons of different skin rashes. There's also a condition called Raynaud's phenomenon, where your fingers and toes turn white or blue when you're cold, and then fatigue and malaise are very common too.
So, given all that, what's the main goal when it comes to treatment?
Just reducing the inflammation and damage that's happening to the body's tissues.
Hmm.
Because it can affect so many different organs, each treatment plan is going to be unique.
And like with RA, diet and activity are important. What are some of the things people with SLE need to keep in mind?
Yeah, so corticosteroids are often a key part of managing SLE, especially when you're having a flare-up. But they can really mess with your body. They can lead to high sodium levels, high blood sugar, low potassium, and fluid retention. So people with SLE might need to reduce their sodium intake, their sugar intake, and make sure they're getting enough potassium. And doctors will usually tell them not to drink too many fluids. When it comes to activity, rest is really important, like 8 hours of sleep and taking breaks during the day, but regular gentle exercise is also encouraged to help with muscle weakness and fatigue.
So, medication-wise, are the drugs similar to RA?
Yeah, there is some overlap. They'll often use NSAIDs, corticosteroids, and hydroxychloroquine, especially for more mild cases.
Okay.
But for more severe cases, they might need more powerful immunosuppressants like cyclophosphamide or azathioprine.
Yeah.
They suppress the overactive immune system.
Okay, so we covered RA and SLE. Now, what about myasthenia gravis? This is another autoimmune condition, but it seems to target muscle strength specifically.
Right, so MG, or myasthenia gravis, is when the communication between nerves and muscles gets messed up. And that leads to a lot of muscle weakness and fatigue. Just like RA and SLE, the severity of MG can fluctuate. There will be times when symptoms are better and times when they're worse. What's actually happening is the body's immune system is attacking receptors at the point where the nerves and muscles communicate. So the signals telling your muscles to contract aren't getting through.
So what are some of the symptoms?
Well, the main ones are muscle weakness and fatigue. They get worse when you're active and better when you rest. A lot of times it affects the muscles that control eye movement. So people will have double vision, that's diplopia, and drooping eyelids or benathesis. They might also have trouble chewing and swallowing, which can lead to choking. When they're diagnosing MG, a doctor will look for these symptoms, and they might do some imaging, like a chest X-ray or CT scan, to see if the thymus gland is enlarged. But the most accurate test is an EMG, which measures the electrical activity in the muscles.
Okay. The information we have here also mentions some pretty scary complications.
Right. There's respiratory distress, which is when the muscles involved in breathing get too weak.
Oh, wow.
That's a medical emergency. The symptoms are shortness of breath, rapid breathing, fast heart rate, and you start sweating a lot.
Yeah.
Then there's myasthenia crisis, where the muscle weakness suddenly gets worse, and it affects your breathing and swallowing. It can be life-threatening. This can happen right after you're diagnosed, if your medication isn't working well, or if something triggers it, like an infection, surgery, or pregnancy.
Oh, wow.
And then there's cholinergic crisis, which is when you've actually taken too much of the medication for MG. The thing is, the symptoms can actually look a lot like myasthenia crisis.
How do you tell the difference then?
They use a test called the edrophonium test. It's a short-acting drug that temporarily improves muscle strength if you have MG. So if someone's having a crisis and they're given this drug and their breathing or muscle strength gets better, then it's probably myasthenia crisis and they need more medication. But if they're in cholinergic crisis, meaning they've had too much medication, this drug will make their symptoms worse.
Okay, so it helps determine the best course of action. What about treatment for MG in general?
Well, a lot of times they'll remove the thymus gland surgically.
Okay.
That's a thymectomy. And then there are medications that can help improve muscle strength and nerve-muscle communication.
You mentioned anticholinesterase drugs. How do they work?
So they block the enzyme that breaks down acetylcholine, which is a chemical your nerves release to tell your muscles to contract. So these drugs are basically making sure that more acetylcholine gets to the muscle receptors, and that makes the muscle stronger.
Hmm. Are there any diet or activity recommendations for people with MG?
Yeah, since anticholinesterase drugs can cause an upset stomach, they usually recommend eating before you take them. If swallowing is difficult, they might have to modify the texture of their food, so like chopping it up or mashing it, pureeing it. Sometimes they need to thicken liquids.
Hmm.
And then since muscle weakness gets worse with exercise, they need to avoid strenuous activity, but they also need to build in rest periods throughout the day. Gentle exercise, like range of motion, and using supportive devices like walkers and braces can be helpful.
Okay, so we've covered 3 autoimmune conditions. Let's move on to HIV/AIDS.
Okay.
That's when the immune system itself is weakened, right?
That's right. HIV, the human immunodeficiency virus, is a retrovirus that specifically attacks and damages the immune system. AIDS, acquired immunodeficiency syndrome, is the most advanced stage of HIV infection. It basically means the immune system is so weak that it can't fight off things that wouldn't normally be a problem. And that means people with AIDS are vulnerable to opportunistic infections and certain cancers.
Okay.
It's really important to remember that AIDS is the final stage of HIV infection if it's not treated. And the virus itself is unique. It inserts its genetic material into the host cell's DNA. So basically, it's hijacking your cells and using them to make copies of itself.
And how's it transmitted?
HIV is transmitted through certain bodily fluids that have a high concentration of the virus, mostly blood, semen, preseminal fluid, rectal fluids, vaginal fluids, and breast milk. So it's mainly spread through unprotected sex, anal or vaginal, sharing needles, and from mother to child during pregnancy, childbirth, or breastfeeding.
Okay.
And one thing I want to emphasize, HIV is not spread through casual contact, like hugging, shaking hands, or sharing utensils.
Good point. When someone has HIV, what are the main goals of treatment?
Well, the main goals are to slow down the progression of the infection, prevent it from developing into AIDS, and just manage any symptoms or complications.
Okay.
Ultimately, the goal is to help people with HIV live long, healthy lives.
What about testing and monitoring the infection?
It's really important to catch HIV early. They usually start with an HIV antibody test, like the ELISA test, and if that's positive, they'll do a more specific test called the Western blot to confirm. Once someone's diagnosed, doctors will monitor their CD4 plus cell count.
Okay.
Those are the white blood cells that HIV attacks. A normal CD4 plus count is over 1,000. But when it drops below 200, that's one of the things that means you have AIDS. It means your immune system is severely compromised. Another important test is viral load. That tells you how much virus is in the blood. The higher the viral load, the more active the virus is.
Makes sense.
And they'll also do other tests like a white blood cell count, complete blood count, and liver function tests to check your overall health.
So by monitoring the CD4 count and the viral load, they can really keep track of how the virus is impacting the immune system. How else do they manage HIV?
Well, monitoring is just the first step. They'll also focus on preventing opportunistic infections. Those are infections that wouldn't cause a problem if your immune system was working properly. And then, of course, there's antiretroviral therapy, or ART-T. That's the main treatment.
Okay.
And if they do get an opportunistic infection, it's important to diagnose and treat it quickly. And they'll also manage any symptoms that arise from either the virus or the medications.
You mentioned RT. Can you talk more about that?
Yeah. ART uses several different classes of drugs that attack the virus in different ways and prevent it from replicating. So there are NRTIs, which are nucleoside analog reverse transcriptase inhibitors.
Yep.
They interfere with an early stage of the virus's replication. Some examples are sidovudine and lamivudine. And then there are NRTIs, non-nucleoside reverse transcriptase inhibitors. They also work at that early stage, but they bind to a different part of the enzyme. They're usually used in combination with other RT drugs, and some examples are nevirapine and efavirenz.
Okay.
And then there are protease inhibitors, which target a later stage by blocking an enzyme the virus needs to replicate. Examples include ritonavir and nelfinavir. These drugs can cause some side effects like nausea, vomiting, diarrhea, and fatigue.
Mm.
HAART, or highly active antiretroviral therapy, uses a combination of at least two of these different types of drugs, usually an NRTI and a protease inhibitor. And it's very effective at suppressing the virus.
Mm.
And guidelines today recommend starting ART for anyone with HIV, regardless of their CD4 count. The idea is to hit the virus from different angles to keep it suppressed.
Makes sense. Now let's talk about the complications of HIV/AIDS.
Okay.
They're often called opportunistic infections, and it seems like they can affect pretty much any part of the body. Let's start with the lungs. What are some of the common infections people with HIV/AIDS get?
Okay, well, in the lungs, one of the most common is pneumocystis carinii pneumonia, or PCP. It causes fever, shortness of breath, and a dry cough.
Hmm.
And it's usually treated with antibiotics like trimethoprim sulfamethoxazole, also called Bactrim.
Okay.
Another one is histoplasmosis. That's a fungal infection. And it comes from a fungus that lives in soil that's contaminated with bird or bat droppings. It can also cause fever and a cough and fatigue. And it's treated with antifungals like amphotericin B or itraconazole. And then there's tuberculosis.
Yeah.
That's caused by bacteria and it's spread through the air. It causes a cough that won't go away, fever, night sweats, weight loss. And if you have HIV and you get TB, you'll need to take a lot of antibiotics for a long time. And it's important to wear a special mask, the N95, to prevent spreading it.
Hmm. What about the GI system?
A big one is Mycobacterium avium complex, or MSC.
Okay.
We think people get it from water or soil, and it causes fever, fatigue, weight loss, diarrhea, abdominal pain. They usually treat it with a bunch of different antibiotics. Cytomegalovirus, or CMV, can also cause problems in the GI tract. It's a type of herpes virus, and the symptoms can vary a lot. Some people get diarrhea, some people lose weight, some have a fever. It's treated with antivirals. And there's cryptosporidiosis, an infection that's caused by a parasite. It can cause really severe watery diarrhea, abdominal cramps, and weight loss.
Wow.
The treatment for that is more about managing the symptoms and staying hydrated. Hepatitis B, C, and D can also be more severe in people with HIV. And then there's HIV wasting syndrome. That's a complex one. It causes severe weight loss, muscle wasting, weakness, and sometimes diarrhea, fever, and fatigue. It's caused by a few different things working together, like the HIV itself, opportunistic infections, and also people with HIV might have a decreased appetite. So the treatment focuses on nutrition and treating the underlying causes.
What about the mouth?
Oh, yeah. Oral candidiasis, or thrush, is really common. It's a fungal infection that causes white patches in your mouth. And then there's esophageal candidiasis, same fungus, but it's in your esophagus, so it causes pain and makes it hard to swallow. They're usually treated with antifungals, either topical for thrush or oral for the esophageal kind. And there's also oral hairy leukoplakia. It's those white, hairy-looking patches on the tongue.
Okay.
It's usually caused by the Epstein-Barr virus, and it usually goes away on its own.
Okay. And what about gynecological problems?
Vaginal candidiasis, or a yeast infection, is really common and causes itching, burning, and discharge. That's usually treated with antifungal meds. And then there's cervical intraepithelial neoplasia, or CIN. It's when the cells in the cervix start to change. It might not cause any symptoms in the early stages, but as it progresses, it can cause abnormal bleeding. Regular screening is really important, and the treatment depends on how far it's progressed. It might involve removing the abnormal cells, or they might have to do a more extensive procedure if it's developed into cancer.
Okay. And the central nervous system.
Right, so there's AIDS dementia complex. It's caused by the HIV virus infecting the brain.
Wow.
It affects your thinking, memory, concentration, and motor skills. Treatment for that is ART. Then there's toxoplasmosis.
Okay.
That's caused by a parasite and can also affect the brain. It causes headaches, fever, confusion. They treat it with antiparasitic meds. And there's cryptococcal meningitis. It's a fungal infection of the membranes that surround the brain and spinal cord. That one can cause a really bad headache, fever, stiff neck, and it affects your mental state. And that one needs to be treated aggressively with antifungal medications.
Are there certain cancers that people with HIV/AIDS are more prone to?
Yeah, because their immune system isn't as good at fighting off abnormal cell growth. Kaposi sarcoma is one.
Okay.
It causes lesions in the skin, lymph nodes, and other organs. It's linked to a herpes virus, and they treat it with radiation and chemo. Non-Hodgkin lymphoma is another one, and it's a cancer of the lymphatic system. It can cause different symptoms depending on where it is. It's usually treated with chemo and sometimes radiation.
Mhm.
There are also certain other cancers that are more common and aggressive in people with HIV, like cervical and anal cancer.
And what about blood disorders?
Right. Anemia, leukopenia, and thrombocytopenia are all common in people with HIV.
Mm.
Anemia is a low red blood cell count. Leukopenia is a low white blood cell count. And thrombocytopenia is a low platelet count. There are a few different things that can cause this, like the HIV itself, opportunistic infections, and side effects from medications. And the treatments are all different depending on what's causing the problem.
Okay.
Then there's a granulocytosis, which is a severe drop in a specific type of white blood cell, and that increases your risk of serious infections. DIC, or disseminated intravascular coagulation, is really dangerous. It's when your blood clots abnormally throughout your whole body.
Wow.
And then there's hemophilia, which is a bleeding disorder that's usually inherited. Bleeding can be much worse if you also have complications from HIV. We've already talked about thrombocytopenia. And Hodgkin lymphoma and non-Hodgkin lymphoma are cancers of the lymphatic system.
Okay.
Myeloma is a cancer of the plasma cells in the bone marrow. All of these blood conditions have different symptoms like fatigue, easy bleeding, easy bruising, increased susceptibility to infections. And again, the treatment really depends on the specific condition.
Wow, we've covered a lot. We've gone from the immune system attacking itself to it being so weak it can't fight off anything.
Yeah,
It's pretty amazing how complex the immune system is.
it really is. I just
And
wanted to give you a better idea of what's going on with these autoimmune and immune deficiency disorders.
yeah, I think we did a good job of showing how they're diagnosed, how they can present, and the main ways we treat them.
Yeah, definitely.
So it's really incredible to think about, how our immune system can malfunction in so many different ways
Right.
and how important it is to, our overall health. What do you think are some of the biggest questions researchers are asking about these conditions? And what are some of the things they're working on to try to help people living with these conditions? It's really remarkable how our bodies have these defense
Oh,
mechanisms
yeah.
and how much trouble we're in when they don't work properly.
Absolutely. Maybe maybe figuring out what triggers autoimmune responses would be a good place to start. And then developing more targeted therapies that have fewer side effects for both autoimmune diseases and HIV.
Yeah.
That would be huge.
Yeah, absolutely.